Now let's take a look at how frontliners outside Metro Manila are handling the coronavirus crisis. Zamboanga City has reported 8 confirmed COVID-19 cases, and authorities are preparing for an increase in numbers. We now speak to Dr. Marissa Lim. She's the director of Ciudad Medical Zamboanga. Doctora, good morning.
Good morning.
Thank you for joining us here on New Day. Doctora, different hospitals in your city have banded together to manage a quarantine facility. So we understand now a local hotel will be used for suspected COVID cases. Can you tell us more about that?
About March 25, the city government, Department of Health, and a group of the Philippine Private Hospitals Association of the Philippines got together, and then we started a quarantine facility in a very old hotel. So now we're catering to since we started, about 45 PUIs. These are patients with very mild symptoms. They're admitted, they're quarantined for 14 days, and after that, we give them a certificate for them to be able to reintegrate into the community.
Doctora, could you give us a picture of Zamboanga City's capacity to handle severe COVID cases? Would you have enough ICU beds for the entire city?
ICU beds, the private hospitals each, I think, would have between 5 and 10 hospital beds, ICU beds. So if we count all of it, I think we just have about 100 ICU beds, and that would be really not sufficient if we have a surge with severe cases.
I see. And of course, Zamboanga City, your hospitals have to cater to patients not just from your city, but also coming from different parts of Western Mindanao, including provinces like Basilan, Sulu, and Tawi-Tawi. How are your hospitals managing so far?
For the non-COVID patients, where the census are pretty down because people don't want to go to the hospitals. So for non-COVID patients, we are able to cater to the surrounding areas like Basilan, Holo, Tawi-Tawi. We're doing fine with that. But for COVID patients, it's difficult to transport them in because we have a lockdown. But I think we will be able to cater to them at this point in time because we only have 8 positive so far. And there are about 100 POIs in the community, but they're mild. So we are able to manage them at this time.
Doctora, how is the supply of medical equipment in Zamboanga City hospitals? Do you have enough PPEs, and are you getting help from the national government?
The local hospitals actually started ordering supplies, but because of the lockdown and because the whole world is your competitor when it comes to getting the supplies, we are actually stuck maybe for a good number of days, like 2 weeks, and then we're going to have to order again, and it's very difficult to get those PPEs and those masks and those goggles down to Zamboanga. Also because there are no regular flights and we are lost on the route of the planes that does the dropping off of the supplies.
Yes, understandably. Doctora, what are the other challenges that your hospital and hospitals in your area are facing in terms of providing critical care in this pandemic?
Well, I think like all other hospitals, if we have patients in our hospitals, it's the staff. They don't like, they fear for their safety, so not all of them would want to serve. Logistics is also a problem because of the delivery of supplies. There are some medications that cannot come here that we really truly need them, which are critical meds. The other thing is the sustainability. If the projections are right and there's this pandemic is going to push through until May or June, sustainability of hospital operations, trying to pay the staff, trying to do all that is going to be a really big challenge.
Another challenge, Doctora, is this: the health department recommends the cremation of people who died, even of just suspected cases of COVID-19. But I understand there are no crematoriums in Zamboanga City. If that's the case, how would you be handling the disposal of remains?
Right now, I don't have any good answer to that, but I know the government, the local government, has been burying them in a designated site uh, far away from Zamboanga. I think a few kilometers away from Zamboanga. They're taking care of them.
All right. Thank you for that. And thank you for your time this morning, Doctora Marissa Lim of Zamboanga City.